Hi everyone, good morning and welcome to Conversations with MM. This is Marivir Montebon here in New York City. Today is Asian American Pacific Islanders HIV AIDS Awareness Day, National Awareness Day. So we have a very special guest, a CEO of the caregiving community. She is no other than Ms. Therese Rodriguez. Therese is the CEO of Apicha Community Health Center. She is also a board director of the Medicaid. Hi, Therese. Welcome. How are you? Oh, I have to let me unmute you. Sorry. Good morning, Therese, and thanks for joining us today.
Hi. Good morning, Marivir. Thank you for having me.
Yes, hope you're okay, doing well, struggling more as our issues on health are being challenged so much. So I read the op-ed that you sent. Thank you so much, Therese. It's out on social media. I'd like to ask you immediately on tell us what's at stake if the budget is being cut for HIV/AIDS patients.
At stake will be the current services that are now being, provided people who are living with HIV/AIDS, as well as it's not just medical. It's a whole lot of support services, mental health services that will allow them to really live, a quality of life that is, that can be afforded by the support of federal, state, and city funds. It is an epidemic, and therefore it is, and until we have the vaccine, it's very important that they are availed of all the most important developments, including, for example, the access to medication that will suppress their viral load, allowing for them to lead a quality of life, as well as also prevent the spread of the epidemic. The important thing is the infrastructure of HIV work has been erected over decades. Yes. And as we have done this, we are seeing the possibility of ending the epidemic even before the vaccine comes, which means it will really result in not only the quality of life for the individuals, but it will eventually, create a society where not only can we bring down the cost of, the HIV, care for the HIV, but by bringing down the spread of the epidemic, it will keep the members of society healthier, as well as bring down the cost of taking care, bringing treatment and care.
So it's important to really sustain such budget, isn't it? Because
yes,
it could erupt. It could be a big epidemic than how it was before.
Correct.
So is there an effort on the part of the health communities to lobby with congressmen and in fact also the court to stop whatever cutting of budgets will be done?
Yes, the community has been preparing and organizing, sending sending messages to their elected officials, telling them that the loss of Medicaid, which supports supports a substantial, provides a substantial, support for the cost of, taking care of the people living with HIV/AIDS, as well as also preventing the spread of the epidemic, not only through, medication, but community work, prevention messages, being out there talking about the importance of, for example, the pre-exposure prophylaxis, PrEP, educating the community that there are developments in biomedical approaches that can prevent the people who are HIV negative not to convert to being positive. So there's just so many possibilities of a better future if we continue to sustain the infrastructure of
Right.
the support for the HIV infrastructure, and by beginning to tear it down,
Mm.
it is not it's a flawed policy, because it will there are so many related diseases that will also be affected. For example,
Yeah.
so many of those who are with HIV are also dealing with issues of cancer, of h-
Yeah.
heart heart diseases,
Mhm.
hypertension, and all of those, because they are being taken care of within a system, and the social determinants of health are also made available to them. It truly helps, the the society to begin to get to that point of ending the epidemic.
So, Therese, is there a timeline that they are looking at? When will the budget cut happen, if ever it will?
Well, there's a whole lot of discussions that's going on
Yeah.
in the U.S. Congress, and until the those of us who are able to convince our electeds that it is important for them to defend the Medicaid.
Yes.
What will happen is that it will be the states and the cities who will have to take on the responsibility of taking care of those uh, affected,
Mhm.
and therefore it's going to be a very heavy burden on the state, rather than being part of the national support that's being provided by the federal government.
So,
And it involves their constituents. Uh,
right.
yeah, so it's not just a matter of cutting it. It is going to bring down so many systems, not just the HIV systems, but so much of all the other systems that are impacted, and who take care of the issues that confront folks who are with HIV. For example, health centers are taking care of the primary care of those who are impacted. So with the cut of that, their services will also be cut. And when you cut services, it doesn't just impact one population; it affects everybody else. So it has so much implication to
It has a
to
ripple effect.
it has, yes, it does.
So, just in case the congressmen are able to, consider the demand of the local communities to continue the budget, and it could be that the executive arm will not honor that and still continue to not provide the budget as it had been. What will the communities do, like your organization and like organizations?
Well, really, the importance of the state and the city, they will have to take on the
Yeah.
responsibility, and we will have to figure out all different ways of how we can also partner with other entities that could help us in being able to take care of what we're doing right now. But that's almost like Medicaid takes care of so much of the health
Yeah.
needs of the community. It's how do you recklessly just cut without really analyzing, what are the needs versus what can really be cut? Because certainly, as we're moving in the direction of ending the epidemic, we
Yeah.
need to keep we need to keep both the medical and the prevention information so that we can keep the systems intact until we get to really a point of being able to end the epidemic and to get there, yes, there would be enormous savings if we are doing it, if we're doing it judiciously rather than slashing, without any planning and thinking.
Yeah. But is New York not economically able to do it by itself as a state? Because it's a notion that we are a very rich state and therefore we can handle it.
Well, even without the situation that we're facing right now, it's been also, a struggle to keep, the momentum of the end of the epidemic programs. And so we also have to convince the state that it is very important to protect and support the HIV work in the state. And so that means really figuring out how to raise, tax levy in order to
channel it to health.
Channel it, right? But that means there's just at this point there will be a lot of competing health issues, and it is I'm concerned that because of the history of discrimination against who carries the brunt of the HIV epidemic, and that's the LGBT community. That kind of discrimination and prejudice might come into the picture of how that is going to be taken care of. And so we are going to have to continue, convincing our state and also asserting the importance of taking care of the most vulnerable of our communities.
It's very sad because, the HIV patients are most vulnerable in our society, and they are it's a question of life and death already, Therese, actually, when we talk of health. And are you spending your days lobbying with the legislators this time?
All of us in the HIV movement, all of us in the community health center movement, all of us are out there really trying to figure out building community, educating our representatives, providing resources, doing this, talking with media, so that there's conversation about what really is an efficient way of saving, right? What we want to do is save the, bringing down the cost. But that's a conversation that should happen and should not just happen overnight and without any conversation with those who will be impacted. And, it will not just be the people who are infected with HIV, but their family, the community, the neighborhood, and the city, and the different counties in the state. So we cannot afford to have an increase in another epidemic when we are also looking out for other things that may come back, like COVID-19 and all of those that do impact public health infrastructure that needs to be available and strong enough to pivot whenever there is such developments
It's
in our communities.
It's scary if government is looking at budget cuts, but what will break loose will be another epidemic, and it will impact all of us. So this has to be carefully done. It's not just a matter of saving dollars for whatever reason, right? So tell me, will it be the budget cuts? Will Apicha, for example, which is a very an icon in healthcare. Will you, God forbid, likely be closed if in case there will be budget cuts? I hope not. Maybe
We
doing everything in your powers. Not
Yes, we have to. Apicha has always been, struggling, to survive, and is able to survive and thrive and grow. But
with your leadership, yes.
and the senior management and staff that surround me, who are very dedicated, and it is that we will continue to be able to keep our services going. But when they start, it's not just the cuts per se, because we have some that can keep us going for
Okay.
now.
Okay.
But if they say, oh, you cannot you cannot you cannot provide this kind of care because we don't like this population here, right?
Oh, like
As
discriminatory.
Right, discriminate. So we will have to figure out, how do we take care of those who are vulnerable when they're not going to get supported by federal money. So our attention will
Yeah.
have to be towards, seeing to it that our community, particularly in this case the transgender community, gets the full, the full service that they need in order, to have a good quality of life, and deal with the mental health issues and all the medical issues that visit every individual. So it's going to be very difficult if certain funds will be kind of not going to be reimbursed because of certain ideological issues, because we're not just talking about health. There is, so those are the things that we are concerned about, that a good portion of our Medicaid, for example, support, the Medicaid support, as a health center, is coming from Medicaid. But in order for a health center to be healthy, and sustain itself, its reimbursements from Medicaid should be around 50 to 60% of the revenue that comes. Right now, because we take care of many, we're still, one of the newer FKCs. We have only about a third of our revenue coming from Medicaid.
And everything from private insurance?
No, the Medicaid. So what's important is that when Medicaid, a third of your budget, of your revenue is removed from, it's whittled down more and more. We will have to face the thing of what services do we keep, right? So it becomes a very difficult thing to sustain the kind of at least just struggling, but to build your resources. But now it is also protecting and defending those that might be taken away. So there's that kind of conflicts that we have. But the most important thing for us is to really build community, build more and more support for the community health center movement, for the HIV movement, so that we can keep educating and hopefully also begin to elect people who are really willing to take care of their constituents, and assist those like us who are part of the infrastructure of the delivery of care, are not so depleted that we have to close our doors.
I know. I hope
So
not.
those are the considerations that continuously always inform our people who make policy and also, control the funds to
Mm-hmm.
see that, the issues that we are taking care of, especially
So,
the medically underserved, are have a voice through us.
right. So, do you reach out to both Democrats and Republicans and independent legislators, Therese?
Yes, we have to, you
Yeah.
know, because we are going to be counting on everyone to see that it has to be a much more, judicious conversation before you just slash things. And
Yeah.
it's there's so many. I'm sure if we really went into a better discussion and and really considering uh, what could be in terms of ending the HIV epidemic, that is a great achievement and really sustain if we're able to sustain that you also bring down the cost to society in both in terms of money and in terms of human lives.
Right. I was very inspired reading your piece, your essay that the end of the epidemic is in the horizon, but now it's being threatened by these budget cuts. So, what do you think is
And And as you know, I
yeah,
because I'm so concerned that because also the HIV money is for countries who cannot who also have huge cases of HIV AIDS. The support of the United States has also been cut, and I'm concerned about that because we're a global world, and
yes,
the bi-directional uh, uh, you know travels among people,
yeah.
United States and those countries can make it very difficult to control the spread of the epidemic if we don't have the resources.
It's really going to be crazy, isn't it?
It's going to
So,
be a pandemic again,
yeah,
and that's harder to control.
yeah. So, tell me your idea, or what do you think is the reason why there's this budget cut? Is it the in the pursuit of privatizing public health? But then I asked before, like, if people cannot afford, what's the point of privatizing it?
There's so many trillions of tax cut for the you know 1% of the 1% of the population,
Mm-hmm.
the billionaires who are going to get trillions of cuts in terms of taxes. In order to pay for those, it will have to be the services, the money for the services that's going to get cut. So 880 billion of Medicaid services that provide services is going to be put in that it is going to feed the tax cut for the rich.
So that I don't think that is sound because that creates further imbalance. And society, if there's no balance, will topple down, will tumble. So I think they should think of it not just by money but by social cost of it, right, Therese?
Oh yes, you be
You have
it's the social cost is tremendous.
right. So you've been dedicating all your life to healthcare, and your activism is inspiring. Any parting words as far as this issue is now concerned? What do you want to impart to our viewers, Therese?
We have a very difficult fight ahead,
Mm,
but what we need is to have the hope that
yeah.
regardless of how difficult things are, if we begin to really come together and bring our resources together, begin to really understand what's going on. In the meantime, also understanding that we have to continue, not only just fighting, but delivering the services. We should not stop. At the end of the day, it will be about hope and about seeing to it that we come at the end of this battle weary, perhaps, but at the end of this, a better sense of humanity.
Wow. Thank you, Therese. And my heart is with you. It's all about us, and it's us in this community fighting for our right. Actually, it's our right to life.
Yes, exactly.
Yes. So, ladies and gentlemen, thank you so much for watching, and thank you, Therese, CEO of Apicha and board director of Medicare. So we'll see you again in one of our future episodes, ladies and gentlemen. Take care of yourselves and take care of each other. Bye for now.